Welcome back to Tales from the Lab, a veterinary podcast. As you may have noticed, we've made some exciting changes around here. I am your new co-host, Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antech. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Hello, everybody. Welcome back to another episode of Tales from the Lab. I am Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech Diagnostics. And today is World Mental Health Day, and we are kicking off a three-part series on mental health. This first episode that we're going to dive into today is on boundary setting. And in the weeks to come, you can look forward to episodes on the topics of self-compassion and cultures of well-being. And they all are interrelated. And we hope that these are episodes that you will see yourselves in, that you'll see your colleagues in, that you'll be able to share and chat about in the months and years to come. Because mental health, as we all know, is a huge topic that's gotten a lot more attention in recent years, fortunately. And we have the perfect guest here today to discuss these topics with us. We have Dr. Jen Brandt, who is the AVMA Director of Member Wellbeing Initiatives. She received her PhD in social work from The Ohio State University. And I met her quite a while ago when I was a vet student at The Ohio State University College of Veterinary Medicine. Prior to joining the AVMA, Dr. Brandt spent the majority of her career at The Ohio State University College of Veterinary Medicine, serving as the Director of Student Services. And she is the person to talk to about what mental health and well-being in our profession. And we're so grateful to have you here today, Dr. Brandt. Thank you so much for joining us.
Thank you for inviting me. It's my pleasure.
And we're going to start with hopefully an easy question for you. And that is, how are you doing? And how are your cats?
Oh, gosh. Well, with the cats, it's always an adventure. Squatchy, who is the orphan model baby singleton, he's now 8, and he is every bit as ill-mannered as he has always been. Fozzie Bear is also, he's doing well, and I have been doing very well. Thank you.
Great. Well, I'm excited to have you on the podcast, and we have so much to get into. And I guess before we get into the specific questions on boundary setting, I just want to take like a big picture view of this. And, when I asked you about mental health and what topics are pertinent and timely and foundational, I'm not sure that for a layperson, boundary setting would have been like front of mind. So can you just kind of start there? Like why has this sort of emerged for you as a foundational topic in mental health?
I like the way you framed that question. I'd say one, because it is something that we do have direct control over, but we don't know that. And many of us are saying we are using boundaries, but we're not. We're doing something else. And so between maybe the misunderstanding of what they are and that we do have control over, and when we do them, they are life-changing, then I think it's an area that is good to focus on. When
I saw you speak on this topic at the Midwest Veterinary Conference earlier in the year, the room was packed. I saw a lot of, copious note-taking going on, a lot of head nodding, a lot of apparent, what it seemed from my point of view, a lot of self-recognition in the things that you were addressing with the audience. And so I think we just need to start, because I think there might be a misconception about what boundaries are and what they are not. So let's just start there. What does it mean when we're talking about a boundary and boundary setting?
So in its simplest term, a boundary is something we do or don't do. It's us. It's our behavior, period. That's it. So I can do that or I cannot do that. I will do that or I will not do that. That's it. That's the boundary. It is often confused with requests and demands, right? So if I'm asking someone else to do something like, please don't yell at me, that is a request. It's not a boundary. If I yell at you and say, you have to stop yelling at me, that's a demand. It's not a boundary. In the instances of a request and a demand, the other person may honor them. They may not. And when they don't, what's different? Nothing. With a boundary, what I'm saying is, if you continue to yell at me, I will end the conversation. I have 100% control over that, whether that's hanging up, whether that's walking away, whether that's going into another room or simply stop talking. That's the piece that I can control. And so often that's confused with telling someone else what to do and then repeating it over and over and over, and then wondering why the pattern of behavior doesn't change at all.
Yeah, and that idea of personal agency, that's the thread that I see through almost all of these topics, isn't it?
Absolutely, 100%.
Right. And because if we're trying to, it just doesn't work. We can't control another person's behavior. All we can control is our response to what's going on and how we show up.
Yeah, I think about through a lifetime, and I'm sure all of us have said this. I know I have many, many times in my life, but we'll think, well, if only something else would happen, if only that person would do that. And they may or may not. But what you realize is you don't want your well-being dependent anymore on that if that thing happens. You want it in your hands. And so when you say, I will or I will not do this, it's based on your values, what's safe for you, what you reasonably can give without overgiving. When that is now kind of what structures your behavior and your response, it creates a much more predictable, healthy, safe environment, not only for you, but for other people. But when we continue to leave it in other people's hands, it's a recipe for no change at the very best. I think in veterinary medicine, I often see the campaigns of, be nice to us, or you need to be nice to us. We take it to social media. Well, those are requests or demands, depending on how it's framed. And once again, you can ask that. It's just, how effective has that been for you? Probably not very, because we don't dictate anyone else's behavior. But when we say, if you're not nice, or if you don't respond in a certain way, I will simply do this other thing. That's what disrupts that pattern of behavior.
Why do you think people, or some people, have such a difficult time with this? And, I think about myself, perhaps it's is there some people pleasing underneath all of this? That might be my problem. Yeah.
There are many, many elements. Yeah, I laughed a bit because I think, we go on to teach what we need. And I always think about my own growing up years. I certainly wasn't taught what a boundary was. I had none. And for many people, when we look at these patterns, we weren't modeled with them. As children, we were generally not modeled. It's okay to say yes or no. You are told you need to agree with what everybody else is doing. If you don't want to hug Aunt Bunny because you don't know Aunt Bunny as a child, you're not told that's okay. You need to go hug Aunt Bunny because she will be uncomfortable if you don't, and you are then responsible. So from ages, 2, 3, and 4, we are really taught that our needs don't matter. It's not intended to be that way, but that's the messaging.
Yeah.
And then without any other training or modeling, to expect that we would somehow then launch into adulthood in workplaces that also have their cultures and expectations, to think that we would magically appear with boundary setting skills is not a reasonable expectation, right? For those who have them, they may have been fortunate to have them modeled early on, but for the rest of us, we've gone and learned them. And often we've learned them and learned to establish them even when there is little support, right? For the people you are finally setting boundaries around, then they'll push back, or you've changed, or, you're not as giving as you used to be. And so there's a lot of social pressure to stay people pleasing and honoring everybody else's needs before your own.
Yeah. And I have the word written down in my notes, needs, and that I have it circled on our conversation coming up on self-compassion. And I wonder, almost in a way, if we haven't sat down with ourselves and had a quiet moment and really thought through what our own needs are, how many people have done that, and how many people are clear on the difference between a need and a want, and so forth. And if we actually knew what our needs were, then we would actually show up for ourselves in a different way, perhaps. And I wonder how many people just haven't done that foundational work yet to like, what do I really need to stay mentally healthy, and what do I need to show up every day and feel safe here, right?
Yeah, and think about again, where did the modeling come from that? Who really, I mean, maybe there are some people out there, I'm not one of them, and I don't know many.
What are your needs?
Yeah, exactly. Who grew up with that language? Tell me about your needs, and then I will honor those needs. So we don't have the language. We may have some words, but we don't necessarily have the language for discussing all of that. It's frowned upon. Sometimes it's vulnerable to say, this is what I need. Sometimes it's vulnerable to say that even to our own selves. But sometimes when we said that out loud, we might be ridiculed for it or put down or criticized for it. You get points for sucking it up and just going with the flow. Think about all the phrases in our culture that are all about that, just go along to get along. There aren't a whole lot of cliches and phrases that we have for asserting your boundaries. That's not been cool. But the more we learn about it, the more we know it has an impact on our health.
So let's move into this topic of personal boundary patterns and what shapes them. I found the information that you sent me on this to be very interesting, and personally interesting because when we get to those common patterns, I saw myself in all four of them. And now I've been aware of this for a while, and I've been working on all of these things. But I think these are going to perhaps trigger some, or make some light bulbs go off when we get to them. But let's start off by let's talk about what these personal boundary patterns are and how they show up in different ways.
So I like to start with kind of a basic explanation. And again, it's a misunderstood area of boundaries, but we sometimes put them in three categories. So they're rigid, they're permeable, or they're adaptable. And we tend to view them then, that means it's good or it's bad. And there's more nuance than that. So, if I set a rigid, let's say I've been wounded in relationships before, and my rigid boundary is I'm never letting anyone know about me ever. I'm never letting anyone in. That's a rigid boundary that we can say will likely have some poor consequences for you, right? Like at some point we have to have some connection. But if my rigid boundary is, if I get a random text or a call from somebody who wants my social security number, I'm never giving that information. That's a really good rigid boundary to have. When we think about healthy boundaries, we think about adaptable. And an image that I was given one time is like a screen door or the screen in a window where information or input can come in or through or out of that screen. So there's some give and take, but there's still some structure to it. And then on the opposite end, we have permeable, which could mean I always give, I always give in. I never assert my own thoughts. Or in its best case, it could be I do allow some other thoughts in, to influence me. I would say the standard that we're going for is more adaptable, but we don't want either on the extreme. And then some common patterns that come out are the people pleasing, the overcommitting, even when your brain and experience have taught you that's not humanly possible, right? But the next person who comes along, hey, can you do me a favor? Sure, I'd love to do that. Avoiding conflict is a real common pattern. And the one you had mentioned before where we don't necessarily know to name our needs, one thing that I tell people is a really good cue for boundaries being violated, even if you don't have the need word that comes with it, is when you start feeling resentment. And it's that I can't believe they asked me to do that. They should have known I was busy. When you start feeling that, it's a very good indicator that boundaries are being violated.
Right. we talk about the fact that, we see these things being modeled for us oftentimes by our parents and perhaps people in our community, leaders in our community. But it's also oftentimes it gets reinforced at the societal level too, right? And it's like everywhere you look, this is how people act. And maybe in veterinary medicine, I think so much about how from the time, I was probably in elementary school and I said, I want to be a veterinarian. Sort of the implicit message is, well, say yes to every opportunity that comes your way, right?
Yeah.
Because you want to build that resume. And, and then there's the scarcity idea too. If I say no, then somebody else is going to grab it and they're going to be at an advantage over me when it comes application time in 20 years or whatever it may be.
Oh my gosh. I'm thinking, yes. As you're saying that, I think of all that was me too. That was absolutely me.
Yeah.
And I always say part of it is I did want to say yes. I did. I'm generally curious. I like to do these things, but so much of that yes, really, when I'm honest with myself, was motivated by fear and that lack, that belief that there isn't enough to go around somehow. But I would also say for people pleasers or people pleasers in recovery or overcommitters, there's also a lot of praise. When I look back to early job evaluations I had, you're the workhorse. You always give above and beyond. You go the extra mile and you're praised for that. And that praise feels great. You just realize that comes at a cost too. And at some point in setting a limit, that comes with realizing you're going to give some of that up, right? Because there are not a whole lot of rewards going around for, wow, you really held your boundaries. And I admire that. That doesn't show up in a lot of work evaluations. So,
No.
Gosh, yeah, it's a challenge. And I think, between you and I, we know lots of people who think the same way. It's tough.
When we're starting to have these aha moments as people are listening to this and they're like, oh yeah, I'm definitely, one to just say yes, because I don't want to deal with the tension of that moment of saying no and having to navigate somebody's response to that might be unfavorable or someone's disappointment or whatever it may be. Right. Or, yes, I definitely feel myself getting resentful all the time and I never say anything about it. And no wonder I feel so exhausted. I'm completely overextended. So for those who are recognizing that as we're talking about this, that's a good thing, right? Because that's the first step towards dismantling it and building a healthier self.
Absolutely. Yeah. Lean into that discomfort. And I will tell you a trick that I still use. So full confessions that it can often in that moment feel like paralysis analysis. Like you don't know if you want to say yes or no, but you might be feeling compelled. I have to say yes. And so my trick is I simply buy myself some time, so if there's a request that comes in, it's let me think about that and I'll get back with you. Now, you're not getting back in a year. It might be I can get back with you in 10 minutes or tomorrow. Do set a time frame for getting back. But then then it gives me time to think about what are my motives? And often I will ask myself, am I doing this because I want to? And want could be for even a bigger purpose. Like personally, do I want to spend time on this? Maybe not. Do I believe it's for a greater good and worth the time? Yes. Or am I doing it because I feel guilty or obligated? When I'm doing things because I feel like I have to, guilt or obligation, it's more likely to create the resentment. So those are some of my layers for decision making. And then even if I want to, then but can I do this now? Is this reasonable? What am I not doing now in order to? And so again, even if you're getting back in 10 minutes, it allows your brain a little bit of time to do that processing so that whatever you answer, whether it's yes or no, and that part isn't a right or wrong answer, whatever it is, it feels fully informed by what you can and want to do in that moment, like what you are capable of. And over time, that gets easier and faster. You won't necessarily need a day to do that processing. But when we're starting out, sometimes that helps. When you're starting out and setting boundaries that may be difficult for loved ones and people who are used to you giving and giving, it can also help to phone a friend in these instances that will help you hold that boundary and help you have an honest conversation with yourself before you respond.
specifically within veterinary medicine, you give when you're on the lecture circuit and you're face to face with a whole room of veterinarians, and it comes question time. Where are the recurrent themes? Like, where are we struggling the most with in terms of setting boundaries? Let's break it into within our teams as colleagues, perhaps with our managers, and then also with clients that are bringing their pets in. Where are we getting where are we feeling the most steamroll, do you think?
So this is interesting. I love this question because I would say what people would say is it's either a client expectation, and then I always have them dig a little deeper. Sometimes the expectations are really their own. This is what I've been told being a good professional is. Once you pull out all the layers, what this really is. And then another very common challenge that causes tremendous strife and challenge in teams is that there's no support for the boundaries. So one person may be holding them or may even be following the policy that the clinic has or that organization has, but someone else doesn't. Like this is the fee. And then the client complains and someone else along the line comes along and changes the, bill, waives the bill or lowers the bill. And that leaves the person who was following the rules, enforcing the policy, doing it exactly how it was supposed to be done, just kind of leaves them hanging there, not supported, undermined, which now will create an ongoing problem potentially with this client who then goes online and says, go talk to Dr. So-and-so, they'll waive the bill, right? There's this whole ripple effect that happens. So I think it comes down to that, who really has the power on a team to hold the boundary? And that's really unclear. Mixed messages. Yes, you're allowed to hold the boundary, but then if someone complains, no, you're not. And so much of the time it's really more within the team. That's the true challenge as opposed to the perception that it is the client, because ultimately the team is the one that is responsible for making the decisions that they make in that organization or that practice.
Do you think that some veterinarians struggle to connect the dots between the lack of boundary setting and that slow progressive burnout that eventually reaches a complete, a complete shutdown in some cases, or or leaving the practice? Yeah,
absolutely. Because again, if we don't even have a name for it, boundaries, if we don't know that that's our responsibility, and we're always looking, if those people, whoever those quote unquote people are, if they would just ask less of me or do whatever. So we spend all this time hoping we can influence the entire world around us instead of saying this is a me thing. When that happens day after day after day, it will just grind down your energy. And before you know it, you will look up and think, I have absolutely nothing left to give. And often we'll still say, because it's quote unquote those people, right? It's very rarely as I'm burned out and I wonder what contribution I have made, right? Yes, there are absolutely external factors. And also, what are some of the ways that I potentially contributed to that and what could I change? So, and I think most of us at some point maybe miss that connection.
Yeah. So let's talk about, these conversations are getting a lot more traction thanks to you and others that are leading on this front. What does a culture look like that's moving towards this, and how do they know when they've arrived at a place where we've actually created this culture where boundaries are respected, where people are free to express them, and we're going to have an open mind and a listening ear as those boundaries are being expressed and try to work towards support. When that's actually happening, what benefits for the entire practice are going to unfold as a result of that?
I would say part of it is some of the benefits come from the process that the team actually did that work. And I'll use a phrase that is not mine, but a shared mental model. If we just say, hey team, we're going to have boundaries now. Nobody knows what that means. Nobody knows what does that look like in translation? Who has them? What language do we use? So the process of even getting to have them truly in place as a team already builds connection. Right? There's so much work that would have to go into explaining what this looks like for all of us and how can we do it consistently. When we do then have that in place, we see so many benefits, including improved retention, right? Increased psychological safety, improved trust, improved communication, improved decision making, because now we really are all operating on the same page and not 20 different versions of what this is supposed to look like. Having those expectations clearly stated, and this is what it looks like when we're meeting them, and this is how we hold each other accountable to them, is such a transformation in a team when it happens. And one of the reasons it doesn't happen often is there's work involved in that, right? It is not, we can't just send out a memo. This is really some pretty deep team discussion.
Right. And so as we're working towards that, there need to be tangible tangible steps that we're taking, right? Individually and hopefully as a team, right? We probably can't build Rome in a day. So what would be some first steps, examples of first steps that we could take individually and as a team, and maybe we get to all of them over time, but if we're thinking about like what can I do today to take that first step, what does that look like?
Absolutely. So I think on an individual level, it really is just getting some awareness about it, right? It might be in this, you don't have to do this with an audience, right? This could be on your own, but I do feel resentful at times, or I have noticed I'm feeling angry at times, and what is consistent about those times, or what are some themes? So you might start to even identify where the boundary breaches are happening, and that is a key first step. Then it could be, what is a statement I can make around that? And I would say start low risk, right? If it's, I need to talk to my boss and set all these boundaries, I don't know that I would necessarily start there. I might start with something smaller, and it might even be, I will turn my ringer off at 7 p.m., right? Something like that doesn't necessarily even involve any other interaction. With a team, I think it is to have I would like pick a pain point. And again, this is risky, right? You may not want to start on the deepest pain point that's going to have so many layers and defensiveness that could come up. But when I think about, again, I look at the payment, the common scenario of here's the bill, client sees it, client agreed to the bill on the estimate. Then they go complain to the front desk staff who's collecting the money. The client complains then to somebody else, and then the bill is waived. And so simply having a conversation on, so what does bill collection, or payment collection look like for us? When can there be variability? When can there be some different autonomy and decision making? When do we hold the line? How do we do that then? And then how do we hold each other accountable? Now, again, this one is tricky, right? I'm not saying that's a low risk conversation for a team, but identifying some of those common pain points and then saying, how could this look different for us when we're more on the same page more often than not? And then, like you said, once you even have a foundation for how to do that with one or two pain points, then that skill is transferable to the rest of the discussions your team would have.
I'm a self-identified empath, probably an empath on steroids. And I also identify as a highly sensitive person. So I'm always, taking in lots and lots of stimulation, always evaluating every single person's interactions with each other and how they're, and in some cases, I'm probably making things up too, right? I'm projecting, and so much of that can lead to this like flooding and overwhelm, and that can, I think sometimes I can get in my own way in terms of being able to just put myself a little bit higher on the list, because I'm so worried about how everybody else is going to feel if I set that boundary. Does that make sense? And is that, I don't know if because I feel like that has been a limiting factor for me, worrying so much about other people's reactions and wanting to, it comes back to people pleasing as well, but it's also just this hyper awareness of all these dynamics and kind of getting flooded by thoughts and what might happen if I take this step and kind of defy the status quo. Is there an element of that plays into this, or am I just?
Oh God. Yes. First of all, I'm listening to myself speak. Because believe it or not, that's my wiring. And, I think, particularly if you grow up in an environment that isn't always safe, you become highly skilled at scanning the environment, every sound, the way somebody pulls into the driveway, how a cabinet was closed, or in the workspace, the drawer, it was closed, or if the colleague looked at you, but it's a different expression. And then it's like your brain is hijacked and your body is hijacked. And so, yes, all of that. I'm all for good therapy, right? Like finding a way to help get this out. And learning for me based on that early on, it was, well, gosh, I jump into catastrophizing pretty quick. Their eyeball looked at me different. So therefore the world must be coming apart. And I can say that now kind of facetiously and laugh about it, but that is really where my brain was hijacked to. It's not funny when it is happening. But like having a name for that, this could be catastrophizing. And so some internal dialogue is, this is before you're even setting the boundary, but am I taking what's possible and making it probable? And that's a good one for me. And many times it's like, well, technically it is possible, but like the odds of that happening are so slim. And then again, starting with the lowest risk, when I was really first starting to practice boundaries, again, having never had them modeled, like I went to good friends who wanted that for me, and so like, I'm just going to practice saying no. If you ask me to go to the movies, like they already knew what I was going to say. There was no risk to it at all. But, and then they would kind of coach me on that because my tendency would be then no. And then like this 5-minute explanation, they would be like, Jen, just no, like put a period on it and end it. Like this is getting so awkward. You going out of your way. So like there were so many steps involved in that. And then, depending on the circumstances today, I feel like I've really got a handle on the skill, but there are still certain circumstances that really are very fear-based, have my mind reeling. And so then I just go back to the skills. Is this something I need? What best protects my safety? What allows me to perform at my best? Might the person be disappointed? Yes, that is a possibility. Does that disappointment mean I die as a result? No, no, that is not really likely in this scenario. And I also find that sometimes that fear influences how I go about saying the boundary, which can also have an impact when it's just clear and just, no, I cannot do that. Or yes, that sounds great. Or yes, I can do that. I'll have it to you by next week. Really, if it's a healthy person on the other side, even when they're disappointed, they'll be like, okay, people are not just screaming because an adult has set a rational boundary about what they can and cannot do. But that's fear-based behavior. And sometimes I just have to remind myself, that I'm a grown up now, I like as an adult, I can say these things and do these things. And even if it doesn't go perfectly, I really can bear the consequences. Like that is going to be okay. So there's still a lot of dialogue in my head that happens through the process.
I love the anecdote that you gave at your lecture at Midwest Veterinary Conference about just being able to answer the front door and the solicitor is there and it's just a simple no, not interested, instead of but I thought back on all the times that I've like drawn this thing out for 20 minutes just because I didn't want to hurt their feelings. And it's like, even though they probably had 50 doors slammed in their face that morning, but I'm uniquely incapable of just saying no, not interested, it's not going to happen, don't want to waste your time, but have a lovely day.
Yeah, I will tell you another tip is we don't control people's feelings. Like that's a myth we've been taught. And again, good people, good, kind people really have bought into that because because you're so kind, right? But it's this illusion that I have any power over what anybody thinks, feels, or does. An example I've often given to clients is, so somebody tells you you're a carrot. Is it true? Like, well, we know. No, of course that's not true. But things that could be more true, we tend to take on, but we can still question someone else's viewpoint, like they're calling me a carrot, right? Like it's that far removed, and people are going to be in bad moods. One of the best gifts I had from a loved one time was, because I was, being overly immersed in their feelings and worried that I was responsible for them. And she was like, with all due respect, like there's a whole world that goes on in my own life, and you are not, part of it. You don't control my moods. You don't dictate them. Really, and it was a very loving thing to say, but really kind of like check yourself in terms of the order of power that you actually have in my life. And I'm like, I am going to remember that forever, because it was such a loving, true thing to say. And that also, like, just check myself. They might have a bad day, whether I'm here or not. And probably were already having a bad day before they even knew I was I existed on the planet. So it is a lot of dialogue, though. And I think a lot of practicing, and again, low stakes. I tell people, if you're offered like a cheese and cracker sample at, the grocery store, just practice saying no. Nobody needs to hear about your gluten intolerance or anything else. Just no, or even just like a firm expression, and keep moving. And the more we practice it, the more we realize that this is a skill we have. It won't feel like such a big deal when we get
it feels liberating. It feels liberating, right?
Yes.
It's like there's a freedom and a joy to it.
Yes, thank you for saying that. Like, really, there are times when I said no to something even I wanted to do, but I knew I couldn't. That exhale that you can take, that comes with not feeling that sense of obligation. Like, it is okay to rest. We don't normalize that a lot in our culture, but it is okay to not be going 24/7, 365. Really, more of us could benefit from resting.
Yeah. One of the many things that we can do under the umbrella of self-compassion, which is going to be our next episode that's going to air in a few weeks. And, I think that we've really addressed this topic in a thorough way and a really enlightening way. I hope that everybody who's listening will share this with their colleagues, and this facilitates an emerging dialogue in some practices, or an ongoing dialogue in others, and really with the goal of moving everybody and every team toward a place of better mental health. And so thank you for clarifying for us what boundaries are, why they're so important, and how teams and hospitals can be transformed by prioritizing boundaries. And if there's anything else you want to add, Dr. Brandt, we can close it there. But I just want to thank you for this. This is a great start to the series, and I really appreciate it.
Thank you.
Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues, and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here. Our mental health podcast series is meant for educational and informational purposes only. It is not meant to provide medical or mental health advice, diagnosis, or treatment. If you need mental health support, please reach out to a licensed professional or crisis line.
Tales from the Lab is a production of ANTEC Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.